forward. Welcome to Gut Over It, everyone. I'm glad to see you here tonight. My name is Dr. Vivian Asamoah. I'm a gastroenterologist in Katy, Texas. This is Gut Over It. We've been doing this for the month of February, talking about a GI topic every night, something that you may want to discuss with your GI doc or your PCP about something GI related that you just don't know, you're not sure about, you want to learn more about. So thanks for joining me. We have been at this every night, except one night. The one night I lost power, and I missed everyone. I was kind of sad. I was like, oh my gosh, what am I going to do? Like, there's no Gut Over It. What's going on? Like, and so I was like, should I pre-record and then show it? But we caught up the very next day. So I'm glad we got power. I'm glad we survived. We are survivors, guys. We got this. So yesterday I talked about diarrhea related to infectious causes from boiled, unsanitary water. And today, everyone was kind of like, well, why don't you talk about, uncommon causes of diarrhea? So that's what we're going to talk about today. We're not talking about infection today. Everyone got spooked with the infection thing yesterday. I got a lot of messages like, oh, how do I know if I have an infection? And so I didn't want to frighten anyone, but continue to boil the water. That's important. But we're going to talk about some uncommon causes of diarrhea, things that we don't necessarily think about. So this is really reaching out to people who are like, oh my gosh, I never have a foreign bowel movement. I haven't had a foreign bowel movement since 1927. This is reaching out to people like that who are like, well, I just thought it was normal. I just thought loose stools every day, splatter in the bowl was normal. It is not normal, guys. So if you're having loose stools more than 3 times a day, or just generally loose stools every time, this is a Facebook Live for you. Share this with friends. We're going to just break it down. So initially I thought, should I go like how they teach it to us in fellowship, like in training? We talk about like osmotic diarrhea, malabsorption. That it's kind of boring and it's really hard to remember. So I'm just going to go from common things, sort of just grandma, regular common sense things, to things that are rare that you may not think of, or maybe your GI doc hasn't thought about it yet, right? Or maybe you read about it somewhere and you're like, could that be me? Let's talk about that. So we'll start with common things. Most of the time, when people have loose stools, first thing to look in that drug cabinet. Look in that medication closet. What did the doctor give to you? Because it could be from something we prescribed that's causing diarrhea. So you've got blood pressure medications that cause diarrhea. You also have antibiotics. If they put you on antibiotics and they put you on it for a long time, may cause diarrhea. You have medications like metformin for diabetes that may cause loose stool. And of course, guys, if you're taking laxatives, you got to know that it's probably the laxatives causing diarrhea. Magnesium, anything that has magnesium in it could be causing some of that diarrhea. So be careful of things that should intentionally cause loose stools, because you maybe have constipation and now you're having loose stools because you take too much of it. But from medication standpoint and what your docs may prescribe, think about antibiotics, think about medications like metformin, and think about blood pressure medications. So if you guys love this topic about diarrhea, if you know that you have someone that you need to share this with, go ahead and put in a like, share some love, leave a comment, leave some questions. I'm sure there'll be some great questions to answer tonight about diarrhea related issues. So we've talked about meds. Let's also talk about supplements, because most people think, oh, supplements are, they're natural, there are no issues, but there could be supplements that contain fillers and contain other ingredients that you're sensitive to that cause diarrhea. So whenever you're having diarrhea and you just started a new medication, look it up. When you just started a new supplement, you can stop it for a little bit. I think after stopping it for about 3, 4, 5 days, you notice if there's a difference or not, okay? So medications, we factor that in. We'll talk about treatments later, but let's talk about all the causes. And as you know me, nerdy Asamoah, I wrote it all down. So there are several kinds of diarrhea. Let me go back to what's a diarrhea we should be really worried about. So we talk about acute diarrhea. That's when you've had loose stools for a couple of days to a couple of weeks, no more than 4 weeks. But when you start having diarrhea for more than 4 weeks, meaning 3 bowel movements, loose stools for more than a month, it's now chronic diarrhea, right? So the causes of infection there are much less. Diarrhea for a couple of days, it could be infection, it could be a virus, it could be COVID, it could be that boiled water that's bad, right? It could be something you ate at, I don't want to name any places, but one of those places and you got infected, right? And that usually will clear up. Now, there are some infections, and I remember this happened last summer in Houston. There are some infections that will linger for months, months. So don't always think that, oh, I've had diarrhea for 2, 3 months, it can't be infectious. It can definitely be infectious, and think about parasites. Parasites will cause that chronic diarrhea that just goes on and on and on. Think about parasites like Giardia. There was one parasite that was an epidemic in Houston last summer, and that was Cyclospora. And this was a nasty parasite. It was actually reported to like the Infectious Disease Control Board of Texas and everything, because it gave people loose stools 4 or 5 times a day, gassy. They otherwise felt well, but this nasty bowel movement and this gassiness never went away. And they would often go and see their doctors and get prescriptions for like ciproflagyl, still wouldn't go away, because there were 2 specific antibiotics that worked for this parasite. One was Bactrim and the other one was Alinea. So this is for chronic recurrent diarrhea, and that particular bug was called Cyclospora, and it spread very easily, and it came from fresh produce in the stores. So that was a chronic parasitic infection that caused chronic diarrhea. So that's always one to think about. Think about foods, especially when you're having diarrhea right after eating. Easy things. Did you eat a spicy meal? Right? You're not used to spicy, you ate a spicy meal. Did you have coffee? Did you have a lot of alcohol, right? Did you have foods that you're not used to? Maybe you went to a foreign restaurant, you ate some stuff that you're not used to, but that will give you loose stools for a day or so. And that's about it. So usually that is short-lived and it goes away. And then let's think about intolerance. Remember, we spoke about dairy a couple weeks ago, and we spoke about people who don't have that enzyme to break milk down. So lactose intolerance is one. We spoke about that. Another one is fructose intolerance. I see this quite commonly in my office. Now, it's people who eat fruits and get diarrhea, right? They're like, every time I eat pineapple, every time I eat a very sugary fruit like apple, I have loose stools. It's probably because you have a fructose intolerance. And there is a test that you can actually do to prove this. There's a fructose intolerance test that you can do. So that's actually more common than we think it is. There's also a sucrose intolerance. So this is genetic. And this is one that is actually quite rare and difficult for people to think about it, but easy to diagnose because there's a kit for it. So there's one called congenital or genetic sucrose isomaltase deficiency. So if every time you eat sugar or things with sugar in it and you have diarrhea, you could have that genetic mutation where your body, your intestinal membrane just does not break down sugar very well. All right, so if you're finding this interesting, please let me know. It's wonderful to see so many people on. I hope you guys are surviving, right? Beyond surviving and enjoying this topic. Share it with people you know. Please put in some questions for me so that I can definitely share some answers. And I mean, we're talking about very rare causes. So this is the time to ask and the time to just go through that checkbox and say, hey, did my doc check this? Did my doc check this? Did my doc check that? All right, so we talked about lactose intolerance, fructose intolerance, sucrose intolerance, all those sugary things that you don't have the enzyme for it, you will get diarrhea. Another one to think about, all these sugar-free drinks, sugar-free chewing gum, sugar-free gummy bears contain something called sorbitol and mannitol. And very often those are extremely hard to digest. I mean, you're not actually supposed to digest them so that you don't get calories, right? But that causes a lot of bloating and loose stools. So if you're someone who loves to chew on sugar-free gum and you have loose stools, that could be potentially a cause that maybe you just didn't think about. Some people love to chew on these sugar-free candies, right, all the time, just to have something in their mouth. Think about that as a possible cause of diarrhea as well, all right? Let's move on to food allergies and sensitivities, right? We know, I'm gonna talk about food allergies. That was the topic that I was supposed to do last time, guys, and power went off, I missed it. But that's such an important topic. I've done so much research. I love the topic of food reactions. And I may save that for tomorrow or some other time this week, but we'll dig into it. But I wanted to just bring up food allergies and intolerance as a possible cause of diarrhea. So with food allergies, you have, for example, my son, if he eats an egg, he'll have diarrhea right away. His is a strong reaction, like he has the egg in his mouth and he pretty much swallows it and right away the stool is coming out. No lie, no joke. That is really what happens. And if I give him an EpiPen, it stops right away. So his is an IgE mediated allergy. And if he continues to eat the egg, he can go into anaphylactic shock. That's his reaction. Surprising, but true. And then the other one is an intolerance. Like, so people who eat gluten and their tummy hurts and they're bloated and they have loose stools, people who have casein, so milk, not the lactose intolerance, but the sensitivity to the casein in milk. I have a patient, he eats pork. He eats pork. And if you're listening to this, you know who you are. He eats pork. He loves pork. He eats pork and he gets diarrhea right away. And he gets a bloody diarrhea with pork. And so foods like that, that your body is just sensitive to. And this is where it's helpful sometimes to do a food sensitivity test. But you got to rule everything out first, because those tests are not 100% specific or sensitive, and they're expensive, right? They're expensive. So you want to rule everything out first. Then let's go down a little bit, because we've talked about everything that happens in the small intestine. Gallbladder issues. If your gallbladder is out and you've noticed that you're having loose stools after fatty meals, it could be related to the fact that you're just dumping bile in your stools, right? But then there's another entity called bile acid diarrhea, otherwise known as BAD. Bile acid diarrhea. I love that name. And it's kind of like, it's not a new diagnosis in GI, but it's one that your GI doctor should be paying more attention to, right? So these are people who haven't necessarily had their gallbladder out, but they just dump a lot of bile, which is made in the liver, into their stool. Bile acid diarrhea is hard to diagnose. There's one test available in the United States. It's a blood test. It's pricey. You can't get it through Quest or LabCorp. So you need a GI doc who's going to dig deep, who's trying to get to root cause for you guys, okay? To look for that diagnosis of bile acid diarrhea. In Europe, there are many other tests that you can do, but somehow in the States, not all of those tests are available. 1 second, let me get a drink. I'm surviving, guys. I need this to survive. Please, I need this to survive for now. Okay, so bile acid diarrhea. So we talked about that. That's an important one to diagnose. There's treatment for it, right? If we make the diagnosis. So basically what happens is that your gallbladder's in, but you eat and you just run to the bathroom. Every time you're running to the bathroom, right? And you may see that your stools are kind of greenish. Bile is dumping in there. The bile is not getting reabsorbed where it needs to be reabsorbed. There's treatment for that. It's a powdered packet called cholestyramine, and it works. It works. So bile acid diarrhea. And then, of course, you guys have all heard of irritable bowel syndrome. This is like the diagnosis that I love and hate at the same time, because as a GI doctor, I think there's so much that we don't know about IBS. IBS means so many different things to so many different people. I kind of feel like it's a diagnosis we tag on people when we're really not sure what's going on. But the wonderful thing about medicine today, and the wonderful thing about functional medicine, is that we are learning more and more about what IBS really is. We used to associate it with 30s to 40 young women with anxiety and stress issues and thinking it was all psychological. And now we know that it is so much more. And that is a topic I absolutely love. But in the diagnosis of IBS, predominant diarrhea, there is a component of diarrhea. But digging to root cause to figure out why you have IBS, that's something your GI doc also has to tackle, right? It's not just prescribing medication, but why do you have IBS? That's a very important question. So IBS, and then moving further down, we talked about gallbladder, we talked about small bowel, we did IBS. Moving further down, there's an entity that maybe you guys have heard on NPR radio, Exocrine Pancreatic Insufficiency, EPI. I don't know why the ad comes on NPR radio all the time. I never hear it anywhere else. I wonder if it's the demographic selection, but I hear it all the time. And people who listen to NPR radio, when they come to my practice, they're like, could it be EPI? Could it be exocrine pancreatic insufficiency? And I'm like, okay. So, but yes, it is a diagnosis where the pancreas is not releasing enough digestive juices to digest your food. And what you'll notice is undigested material in that diarrhea, and you'll also notice like an oily emulsion. So the frequency in your bowel movements is important. Whether there's blood, whether there's mucus, the smell, the color, and even oily emulsion can help your doctor make a diagnosis. So be descriptive, guys. Be descriptive about your bowel movements and take those pictures. Now, for exocrine pancreatic insufficiency, there is a test to do. Wonderful. Stool test, we check pancreatic elastase, we check chymotrypsin. It's low, boom, you've got the diagnosis. The treatment, digestive enzymes, right? Easy. Digestive enzymes with every meal, and it works great. You actually, I mean, when you find the diagnosis in people, it's life-changing because all they have to do is take a digestive enzyme and you know, they digest their food better and they're all good. And then let's talk about things that are rare like SIBO, SIFO. I have a question. Is bile acid diarrhea related to fat intolerance? That's a great question. It's not really about fat intolerance. I do think that when you have bile acid diarrhea, you're not breaking down fat well. That is true. You're making a lot of bile, too much bile. And the reason you're making too much bile is that for some reason your liver is just dumping and releasing too much bile and it's not being reabsorbed. Now, there are different causes of bile acid diarrhea, one of them being bacterial overgrowth, right? Another one being maybe you've had surgery where bile is typically reabsorbed, which is at that ileocecal valve, that terminal ileum between the small intestine and the large colon. And maybe you had a resection because of Crohn's disease. That will also give you bile acid diarrhea because that area is where bile actually gets reabsorbed. So that's an excellent question in terms of fat intolerance. I haven't heard of that, but maybe it's something we need to research a little bit more because you have fructose intolerance, sucrose intolerance. Why not fat intolerance? Because bile does break down fat. If you guys think this is interesting, please put in a like, please share some love, put in some comments. I love the questions that are coming through. Bianca, you know you can ask me a question. Ask me a question, all right? I love the questions that are coming through. I'm really enjoying this topic. We kind of edged on, talked about SIBO, so small intestinal bacterial overgrowth, where there's an imbalance in the gut microbiome, meaning you've got some good bacteria, bad bacteria, or not enough bacteria, or too much bacteria. It's just the ecosystem in the gut is off, and that can definitely cause diarrhea, okay, with a lot of bloating. It can also cause constipation. So SIBO, small intestinal bacterial overgrowth, is a very, very important diagnosis that should not be missed by your GI doctor. That should be checked as a cause of diarrhea if they've checked everything else and they haven't found anything. And this is important, guys. When you have diarrhea, you don't need to go straight to colonoscopy. This is colonoscopy. Colonoscopy is important and it is helpful. And we'll talk to you about some diagnoses where it's really helpful. But there's so many other things we can do before we get to colonoscopy. There are great stool studies we can do to check for things like EPI, pancreatic exocrine dysfunction. Is it fructose intolerance? Is it bile acid diarrhea? There's so many other, is that funky parasite, the Cyclospora? You know, so many other things we can do. Colonoscopy is like, I've done all these things, I didn't find anything, or I need to dig deeper. Let's move to endoscopy and colonoscopy. And on endoscopy and colonoscopy, what are we looking for? At the top, we want to get into the small bowel and take biopsies and see, does this person have celiac? Is there some kind of malabsorption process going on, right? So biopsy is very important at the top. And at the bottom, you want to take biopsies and rule out things like inflammatory bowel disease, Crohn's disease, ulcerative colitis, and that funky one called microscopic colitis, where important. If you guys don't remember anything tonight, remember this. 1 second. Tomorrow's Saturday, guys. If you have diarrhea and you go see your GI doc and they're like, we're going to do a colonoscopy, you'd be like, yes, I'm ready for it. Make sure that you ask them, doc, when you go in to do my colonoscopy, take biopsies throughout the colon, even if it looks normal, because you don't want to miss a diagnosis of microscopic colitis. This is an invisible colitis to the naked eye. With microscopic colitis, you go in, the colon looks perfect, but if you don't take biopsies, you'll miss the diagnosis because the diagnosis is made by the pathologist who sees it and the treatment is different. So make sure your doctor takes microscopic biopsies to rule out microscopic colitis. Guys, I think that's it. We went through an extensive list of, one more. I asked my husband this. I said, hey, can you tell me some rare causes of diarrhea? And I thought he was going to say he's an ER doc. I didn't think he was going to have much to add. I was like, let me see what he brings back, you know, and he goes, carcinoid. And that was a fantastic answer because yes, you can have some tumors located in the pancreas, located in the abdomen, located in the liver that will secrete some hormones that cause diarrhea. One of those is a carcinoid tumor. So yes, always make sure that at least once everything has been checked and we haven't found anything, a CT scan of the abdomen and pelvis is still done to rule out a tumor secreting hormone that is causing diarrhea. I hope this was helpful, guys. A lot of information shared. You guys should have, I hope you wrote some of this down, because if you guys have diarrhea or you know someone who has diarrhea, all of these check boxes need to be checked off, including sorbitol or artificial sugars and sweeteners causing diarrhea. And make sure you ask your GI doc all of these questions. Again, I'm Dr. Vivian Asamoah. I'm a gastroenterologist and functional medicine provider in Katy, Texas. This was another session of Gut Over It. February, we are talking about different GI topics, interesting GI topics that you want to maybe bring up with your GI doc, that you want to share with someone who suffers from these issues. And it's been a pleasure this evening again. And we are going to keep surviving, guys. I want everyone to stay positive. We got this. We can do this, Houston. We've done a lot more, so we can definitely do this. And I hope you guys have a wonderful evening, okay? Bye.